PEPFAR, saving lives, investing in people. PEPFAR, partnering for an AIDS-free generation.
Anglo-American became very involved from the early 90s. We had HIV education advisors who had full-time jobs trying to prevent the epidemic amongst our workforce. Towards the turn of the millennium, up to 25% of our workforce was HIV infected, and they were beginning to get sick and die. And this was a problem for the business. It was so bad that when we looked at key jobs within the business, we had to start training 2 people for the same job, so that we would know that if one person got sick, we would have a replacement for that person. And that would be a huge expense to the business.
Well, I think it exploded in the mining industry and has become, I guess still today, one of the biggest areas of influence. I think the prevalence of HIV and TB in the mining industry is more than anywhere else.
In the absence of a vaccine, the Orem Institute was responsible for rolling out what today is known as one of the largest clinical trials, or IPT, ever undertaken. It radically informed what needed to be done to control TB and HIV in the mines.
We did a major study in trying to prevent TB in mine workers using isoniazid. It's a drug we use to prevent tuberculosis. It involved some 80,000 participants in the mining industry, and just getting this work out and affecting so many lives with what we thought would be a completely life-changing approach to this TB epidemic was in itself something of a major success.
If you're only involved in workplace, then you're actually clapping with one hand. It's workforce community that you have to be involved in.
We really had to respond beyond the workplace. And that was a challenge which even a company the size of Anglo-American can't do on its own. We had to find partners who understood what we were doing and were willing to respond to what at the time was an emergency.
For every dollar that PEPFAR has given into community work within the workforce community of Glencore Xstrata, they have also given $1. Glencore then joined forces with the Department of Health and said, fine, we will then fund the bricks and mortar to extend clinics, to build new primary healthcare clinics, to build community healthcare clinics, and that's where we started and how the model of public-private mix came forward.
A similar approach by Anglo-American has proven extremely successful, where PEPFAR, Anglo-American, Virgin Unite, and local government partnered to target underserved communities.
For us, it was easy to provide the facility. That was a capital expenditure. But where would we get the money to provide access to the medicines, the laboratory tests, and the staff that would be needed to deliver the service? That's where PEPFAR came in. What Anglo-American had done with our HIV programs in the workplace, we had shown, because treatment was available, that we were able to scale up testing for HIV, what we call voluntary counseling and testing. And we scaled up those numbers from below 10% right up to 90% of our workforce, checking their HIV status every year. It was an extraordinary initiative, and it suddenly made possible what people had thought was impossible to do. The thing that made it happen was PEPFAR. It was an emergency, and PEPFAR was the emergency response. It brought funding available to show that it could be done in the most underserved areas.
The launch of the Mom Connect program in Soshanguve, Pretoria, is an example of a public-private partnership with a national impact. Through personalized mobile phone messages sent during and post-pregnancy, the Mom Connect program will ensure mothers pay routine and better attention to their health and that of their babies.
The Mum Connect project is an example of the power of collaboration between public and private sector.
A program like Mom Connect is one in which we're able to leverage the bandwidth and infrastructure of the telecom companies, the financial resources of the U.S. government, the technical assistance that we're providing to the messaging on the program, and really the South African government mobilizing the entire public health system. So it's a great opportunity where development partners like PEPFAR, the South African government, and the private sector all come together.
We seeded Breakout Foundation, the implementing partner on the Mum Connect project. And in addition, we provided technical assistance and support to the Department of Health to produce culturally appropriate messaging for the Mum Connect project.
It will send messages to the patient, messages appropriate to their stage of pregnancy. Even after delivery of the baby, it will send messages about the baby, how to take care of a newborn, etc., etc. That's the first thing. The second thing is that the mothers themselves will be able to contact us at no cost to themselves.
Mom Connect is a really, really exciting program and a wonderful opportunity to have a real impact on the lives of ordinary South Africans. And if we can reach 120 million mums and pregnant women, then I think we're making huge strides towards the Millennium Development Goals, but also to making sure that our nation is happier and healthier.
In South Africa, specifically, Johnson & Johnson has a long history of public-private partnerships with the South African government.
We can't achieve this project alone. We can't achieve improvement on outcomes of pregnancy and childbirth alone, starting from our donors to NGOs in the country, which in their own right were trying to do something about pregnancy and childbirth, to the 4 cell phone companies. All of them are partners who are working with us.
The launch of this technology marks a historic moment in South Africa's efforts to fight HIV and improve child health. It represents what is possible with the collective skills and contributions of multiple stakeholders who are brought together to address a very common problem. All 3 pillars working all together to assure positive outcomes for the next generation.
Ultimately, we have to transfer ownership to government, the government of the country, and we are providing the support that sustains the intervention in the long term.
We've had several successful partnerships with PEPFAR, and I think we're united in our goal to really eliminate the transmission of mother-to-child infections in both South Africa and the world globally. So we're really proud of the partnerships that we have with PEPFAR, and we hope to continue working with them to have a real impact in the healthcare landscape.
PEPFAR, partnering for an AIDS-free generation.